Hello, I'm Daniel Edmundowicz. I'm Chief of Cardiology at Temple University School of Medicine and a cardiologist at Temple Health Women's Care at Elkins Park. I went to medical school at Hahnemann University and then completed my residency in internal medicine at Temple University. I then went to Pittsburgh at the University of Pittsburgh for my cardiology fellowship and stayed on the faculty at UPMC for the past 20 years. My family and I returned here to Philadelphia to join Temple and the exciting things happening at Temple Health. The risk factors associated with heart disease in women start very young in life. So while we may think of cardiovascular disease as a disease that occurs in the postmenopausal years, it's very clear that risk factor detection and risk factor control in the premenopausal years is crucial for controlling and actually preventing cardiovascular disease in the postmenopausal years. While it's true that women experience the classic symptoms of pressure in the chest and sweatiness, women also may present with symptoms that are much more subtle: shortness of breath, a little bit of fatigue, the inability to keep up with daily activity. These are subtle things that really must be investigated very thoroughly when we know that there's a significant risk for cardiovascular disease. The services that we provide in cardiology at Temple Health Women's Care include traditional things such as measuring blood cholesterol levels, measuring blood pressure, measuring blood sugar levels, but also importantly, engaging women in a conversation about their lifestyle habits, smoking, activity level, nutrition. All of these things are very important in changing the risk for cardiovascular disease later in life. When you come to Temple Health Women's Care, you can expect several things. Number one, a frank and friendly discussion about your cardiovascular risk, what you've done in the past and what you're doing now to understand your risk factors for heart disease. And if you have particular symptoms or have had a heart attack or stroke in the past, again, a frank discussion about where you are in your treatment and where there may be opportunities for improvement. Importantly, you can expect collaboration with your primary care physician or other physicians who are involved in your care. My personal philosophy is that communication is really the key to helping you be successful in preventing cardiovascular disease and its progression. So thanks for visiting our website, and I look forward to meeting you at Temple Health Women's Care.